Vatican reporting that Pope Francis has presented 2 episodes of acute respiratory failure as he now remains in the hospital for the 18th day. My co-anchor and senior national correspondent Terry Moran, along with our medical correspondent Dr. Darian Sutton, join me now. All right, Terry, what did you learn?
Well, this is new. These episodes today coming a few days after what the Vatican described as a serious worsening of the Pope's respiratory condition. This is more significant language. Acute respiratory failure caused by a significant accumulation of mucus in the lungs that required 2 bronchoscopies to clear abundant secretion. So his lungs are struggling. There's no question about that. They resumed the non-invasive mechanical ventilation. That's the mask on the face. He's not being intubated. And they say that he was alert and cooperative throughout. The prognosis remains reserved, but this certainly sounds like another setback for Pope Francis today.
All right, so Dr. Sutton, what do you think? Is he getting worse?
Well, it's hard to say whether or not he's getting better or worse. I know that we understand that he's in technically a guarded state, but these are, in fact, critical events. If I were to hear these as a physician working in the ICU, I would immediately get up and examine the patient. So he suffered from acute respiratory failure. That essentially means that the patient's body is not responding to the intervention. Their oxygen level isn't getting to that high 95%, 100% that you want it to, despite the aggressive oxygen intervention that you're getting. And one of the reasons can be due to a blockage, for example, to fluid in the lung, which is what they noted here, that required deep suctioning via a bronchoscopy, where we pass a tube into the lung and we suction out that fluid to hopefully allow aeration and oxygenation. The goal is in the delicate lung space to provide that oxygen, and then for that oxygen to transfer into blood to then provide that patient with the appropriate supply. Now, in this case, it seems as though he responded, thankfully, but in these cases, we closely monitor patients after these critical events because, as you've learned so far, these stages can change hour by hour, if not minute by minute.
All right, we'll stay in close touch. Terry Moran there in Rome for us, and Dr. Sutton out of New York. Thank you both.